Well, good day. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. How am I going to enthrall you today with yet another interesting topic, at least interesting topic that I find? Here's what I'm going to go over. I want to explain to you PEMF. PEMF. Peter, Eddie, Michael, Francis. And what it stands for is Pulse Electromagnetic Field Therapy. And what it does is it involves the use of electromagnetic fields to stimulate tissues and cells in the body. So it has been around for a while. It's more in Europe. I think a lot of stuff comes from Europe, where it's not as focused on pharmaceutical stuff. Not that I'm anti-pharmaceutical. It's just that they kind of have a monopoly, and if it's not a pill, you're not going to hear anything about it. It's just not in their best interest, which I understand. They do run a business. So here it has how PMF therapy. I'm using it in the office here at Core Health to relieve headaches. Okay, PMF therapy does allow to improve blood flow and circulation in the brain and the surrounding tissues. So enhanced circulation of blood, in that area can lead to better oxygen and nutrient delivery to the brain cells, which can contribute to headache relief. So yes, my stuff is more anecdotal because I'm not doing a double-blind study. Because of course, if I did do a double-blind study, everybody with a headache would need PEMF therapy. But of course, that's not true. Here's another way that PEMF therapy can help. And again, pulse electromagnetic field therapy. It can influence the balance and levels of neurotransmitters in the brain. Neurotransmitters play a role in pain perception, and imbalance could contribute to headaches. So one of my previous, podcasts, I was discussing tension on the brainstem and how it affects the dura mater and the pia mater. Well, in this case here, again, that tension alone can be causing stress, or it can interfere again with the role of pain perception and the imbalance that can lead to headaches. So while I'm going out there into way out in left field to come up with why it works, well, if it does work, what do you care as long as you get rid of your headaches? Tension headaches, can be caused by muscle tension, tightness in the neck, the head region, could benefit because it does promote muscle relaxation. So basically, it's like charging up a cell. A cell has a positive charge, a negative charge. You want to balance in those charges, and especially brain cells, because you're having headaches, it's going to be affected. So try to understand that sometimes. I'll use this analogy and it hopefully makes sense. If you have an old car and you go try to start it and the battery it won't turn over. Well, imagine these cells, these neurotransmitters are trying to turn over and they're not because they're not getting the proper stimulation. It's down regulated, so it won't turn over. And you sit there and you keep turning the key and you hear it like trying to start, but it won't crank over. So think of something like that as a potential cause for headaches. Your brain is trying to get this thing to start, but it doesn't. And that does require energy, as your battery would require energy to turn over when the car is not turning over. You'll deplete the battery. Well, here, if you can't deplete your brain, but you can deplete the energy in the brain cells, and this is how a neurotransmitter would be benefit from PEMF therapy potentially. All right, anti-inflammatory. There is some research that suggests PEMF therapy has anti-inflammatory effects. Since inflammation can contribute to headache pain, if you reduce the inflammation, you could potentially reduce or alleviate some of the headache symptoms. So I think it makes sense. Listen, pain is your motivator. I get it. I understand. However, pain always accompanied by an inflammation. You just don't feel the inflammation. Like you can go for a great run and still have a heart attack because there's inflammation around the heart. So just understand, inflammation it goes hand in hand with pain. So, but you don't feel it as well. But you won't feel it at all until you have that bad heart attack if you have inflammation of the heart. All right, neuroplasticity. Neuroplasticity is a really big topic, and with today's dementia and everything else going on these days, this is something you may want to pay attention to. PMF therapy has been shown in some studies to help reorganize the neuroplasticity connections. If you enhance the neural connections, like it's a lot easier for the brain cells to work, and this reduction of if the speed of the neural connection is up to speed, is where it should be, it can help reduce the frequency and severity of headaches. And of course, it's going out on a real far limb because there have been no studies on that. So that's the long and the short of it as it relates to PEMF. Now we use it in addition to many other different things that we do here in the office, but um, primarily too, as I would say, is removing tension. We do cervical traction. There's a lot of ways to fix headaches that unfortunately your medical doctor ain't going to tell you because he don't know, he or she does not know, does not have a clue, and because big pharma is not in their ear telling them that, hey, go see a chiropractor for your headaches. First of all, there are virtually no side effects to going to see a chiropractor for your headaches. Okay, that's one big benefit right there. Two, you're not going to be taking medication. Once you get on these medications, hey, oh well, just take it the rest of your life. And is that really a true measure of health that you have to take? Next time you see a Honey Nut Cheerios commercial, and the guy goes, "I just lowered my cholesterol." I mean, really? Do you really think? I mean, that's really extrapolating data. Like, okay, well, a diet high in oat fiber is going to contribute to a lower cholesterol level. Well, does that guy on the commercial really look healthy to you? No, but that's what most Americans are looking like these days, anyhow. And the assumption is that if you take a pill and it changes a number in your blood, or you know, say it changes your cholesterol level, you're taking a cholesterol lowering medication. Does that really mean you're healthy? Are you really going to the gym? Are you really properly eating? Probably not. You know, skip McDonald's, go to the gym next time. Easy for me to say because I am going to the gym in a little while once I finish this podcast. So, pulse electromagnetic field therapy for headaches. Yet another tool in the arsenal of how to fix headaches. And I really do enjoy fixing headaches. If you got questions, I don't care where you are, you can give me a call, 203-656-3636. 203-656-3636. Listen, have a great day. We're going into Labor Day weekend. I'll be down in Asheville, North Carolina, visiting my in-laws. Hope you have a safe and happy ending to your summer. Thank you very much for listening. Dr. Brian McKay, Core Health in Darien, and my podcast, Not Just a Chiropractor, Stanford, Darien, Norwalk, New Canaan. And, if you're in the area, come give PEMF a try. You never know. All right, talk to you soon. Thank you.